Welcome to This Week in Health IT News, where we look at as many stories as we can in 20 minutes or less that will impact health IT. It's Tuesday News Day, and here's what we have on tap. Actually, it's Monday, it's Labor Day. I'm recording this, and I have grill duty, so I'm going to have to leave here in 20 to 25 minutes. I'm going to record this straight through. I'm going to go out and start cooking the brats and hot dogs for the friends who are coming over this afternoon. Let's take a look at some of the news stories before I do that. So we're going to talk about UGM. Because it's news, you should know what's going on. We had two episodes, with one with Dr. David Benzema, one with Dr. David Butler, a new guest with Calyx Partners, and you're going to want to check those out. This is going to be just a brief rundown of some of the things that went on there. Let's see, we have a couple of security stories. That's never good. Hardly ever good. No, these aren't good. But we're going to talk about some security stories that have come up, even an Apple story that's not good, that you're going to want to know about for your iPads, iPhones, and whatnot. We're going to talk about consumerism, talk about medical records. Hey, Google wants to replace the lifespan of your SSL certificates. That's interesting. They want to reduce it to 1 year. That's probably all I'm going to say about that, but just something to keep in your back of your head. If you're in charge of SSL certificates, you might want to make a note of that. Let's see. Let's get to the show. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is sponsored by Health Lyrics. Professional athletes have coaches for every aspect of their life to improve performance, yet many CIOs and health executives choose to go it alone. Technology is taking center stage for healthcare. Get a coach in your corner. Visit healthlyrics.com to schedule your free consultation. Finally, check out the two new services on the website, thisweekhealth.com, Insights and Staff Meeting. Insights is for individuals looking to propel their health IT career forward. You get 2 emails a week with insights from industry leaders, and then I provide some commentary so that you can apply that in your daily life. And Staff Meeting is for managers looking to introduce their team to new thinking and get the conversation started in the right direction. If either of these jump off the page at you, hit the website, sign up today. All right, so let's get to the news. Epic's UGM 2019. I'm going to cover a story here from Eric Lorenzen from Madison.com, which is the local newspaper. But if you want to get a more in-depth detail of what went on, we did 2 episodes, one on Thursday, one on Friday. Dr. David Benzema and Dr. David Butler shared in detail. They were both there, shared in detail. They were kind enough to stop by on their travels home. David was in the airport, and David Benzema was in the airport. Dr. David Butler was at a Starbucks being highly caffeinated, as he told me, and he talked very fast about the things that were exciting about the UGM conference. I'm just going to hit the highlights here and talk about a couple things that I think are news, and we'll just go from there. So Judy Faulkner reflects on the long, strange trip it's been for Epic Systems. As you would imagine, 40th birthday, they reflected on their start in the basement of an office building at Old University Avenue. They dressed in 1979 gear. I wish I had more pictures of that. I'm going to keep scouring Twitter and Instagram for pictures of different people that I would love to see dressed in 1979 gear. I think it would be exceptional. From their humble beginnings in that office building to a workforce of around 10,000, client base of about 400 systems really around the world. So incredible. Nothing but respect for what Judy Faulkner and the team have been able to do really from nothing until today. Faulkner lingered on pivotal points such as introducing the graphical user interface in '94, which she says is the start of the EMR industry. Might be a little hyperbole there, but it's definitely the start of a different chapter in the EMR industry for sure. And also around their efforts to share patient data across different health systems. In the mid-2000s, she reflected on a conversation with her husband, a physician, who complained that to her that the patients were dying due to a lack of exchange between providers. And they've built out a really robust data sharing platform. They have Care Quality. They have Care Everywhere, Share Everywhere. They have, Community Connect. They have a whole host of things that they built out to share the data across their across the Epic ecosystem, if you will. I think the other thing they really did there, which I'm really impressed with, is they really led their clients around the importance of sharing that data and helping them to see the need to share that data across at least all the Epic users within that community. So let's see, let's go on here. This year, Faulkner spent more time focused not just on the past, but also on the present. A portion of her speech focused on ongoing issues around medical software, from the changing regulatory landscape to the growth of third-party applications to doctor burnout and productivity. All important issues. We'll come back to that. She also stressed the importance of utilizing Epic's vast array of features and applications, many of which are automated and artificial intelligence driven, to improve outcomes for patients. She said that Epic would soon launch an initiative to have its customers save 100,000 lives through improved use of the company's technology. So, again, fantastic. If you hadn't listened to it, Seth Hain, VP of R&D for Epic AI, was on the show probably about 4 weeks ago. We talked about a lot of these things. And I think one of the things that's most impressive about it, to be honest with you, is there is advancements being done in places like LA, Seattle, New York, Chicago, where you would think there would be advances. But one of the things that Seth really pointed out in that episode was the advances that are going on in these rural locations, because Epic has been able to build the AI intelligence into the workflow and into the platform, that you're seeing health systems that wouldn't normally do that kind of advanced work, which is exceptional. And then finally, Cosmos, massive database of patient biomedical data that Epic claims could change clinical decision-making and medical records, and a bunch of other things, voice recognition and some other things. I'm going to go back to, again, those two episodes I did, Thursday and Friday, much deeper than what I'm going to go into. But I'm going to talk about two things here. One is the changing regulatory landscape, growth of third-party applications. Changing regulatory landscape could be one area where Judy and I disagree, which I've really touched on a little bit on previous episodes. And Secretary Azar, Seema Verma are really focused in on how do we share data across the entire health landscape. I think if you were to really push Judy on it, she would say, we have developed a way to do this. And if everyone were to go to Epic, I'm not sure she would be this overt, but I think it's what she thinks. If everyone were to go to Epic, if 100% of health systems were to go to Epic, we would have the best data sharing platform across the entire country. And you know what? She is absolutely right. Better than any other platform that's out there. If every health system was on Epic, we'd have a great data sharing platform across the board. The problem is that will never happen. So we have to deal in reality. And the reason that will never happen is because once it gets to a certain percentage, the federal government will step in and they will break up Epic. It'll just happen. So you can't get to 100% of a market and expect to still be around. So we have to explore other options. And since you have these competing platforms and there's really no financial incentive, there's only sort of an altruistic incentive to share that patient data across competing platforms. That's why the federal government has to step in. And I'm not a huge fan of it. I'm just saying this is the quintessential use case for the federal government stepping in, where you have to get Epic data into a Cerner platform and Cerner data into an Epic platform and so forth and so on, or across the entire ecosystem, or a new set of data brokers to emerge that everyone has to share data with. That's the work of the federal government, is to make sure that markets don't get so constricted that there's only one or two ways for something to happen effectively. So I actually like the work that Secretary Azar and Seema Verma are doing. It's going to push Epic a little bit out of their comfort zone, and probably to do some things that aren't necessarily in the best interest of Epic. And same on the Cerner side, in the best interest of Cerner. Cerner's going to have to be able to, provide access to that data, which makes it easier to move into Epic, which in theory makes it easier for a health system to make an Epic decision and move away from Cerner, or to make a Cerner decision to move away from Epic. So I understand why as a business you wouldn't want to do this, but in the interest of patients, in the interest of sharing that data for the same reason, that conversation all the way back in the 2000s, I think Epic can be a leader here, by the way. I think there's a better path than fighting CMS. I think it's partnering with CMS and and identifying a handful of players or a handful of ways that we are going to share information in a way that is secure, and in a way that is effective, and in a way that benefits the patients and does not jeopardize the intellectual property of anyone who has done a ton of work over 40 years to build this out. So that's one, the regulatory landscape. The second is closely tied, and that's the growth of third-party applications. The reality is Epic can't do everything. Cerner can't do everything. The EHR was never designed to do everything. There is not going to be one killer app in healthcare. There is going to be, that is going to be the core system, which is going to house the legal medical record, but then you're going to have all these ancillary systems and applications that reside around it. It's why applications like Xealth exist, so that providers can prescribe applications, right? Because there's not going to be one application that wins. There's going to be a ton of them. There's going to be something around orthopedics. There's going to be something around oncology. There's going to be something around, and we need that innovative community to be able to develop. In order to do that, they need to be able to get access to the data. And I'm a huge proponent of the fact that Epic shouldn't be making any money on access to that data. I don't think me as a developer of an application should have to pay Epic anything but a very small fee to cover their costs. I also don't think that Epic needs to worry about the fact that they have to protect that data more than anyone else has to protect that data. If the federal government is going to force them in this direction, then we have to require the federal government to define what that security mechanism is going to be, to make sure that once Epic says, okay, fine, you want us to share the data with them, we're going to share it with them. Well, this is highly sensitive data about my health. I want to make sure it doesn't get used improperly. And I think, as Judy clearly articulated in her talk, she doesn't want it to get used improperly either. And so until that mechanism is clearly defined and articulated by either the federal government or someone has to define it, and someone has to clearly articulate it, I don't think Epic or any health system should be required to share that data. So from that standpoint, we are in complete agreement. Let's make sure that that gets defined some way, shape, or form. And then the other, in terms of sharing the data across health systems, I think, quite frankly, I think the federal government does need to step in here. And I think in healthcare, we need to think differently about APIs. We see it as a mechanism for moving data from one system to another, where my health data is going to be stored in 75 different health systems. It makes no sense whatsoever. The way APIs work, or should work, is sort of a request and retrieve kind of platform. The one we're most familiar with is UPS, right? I want to know where my package is. I request the data. I retrieve the data. When you go to Amazon today, Amazon isn't downloading all that data and putting it into their system. They have a link to the API at UPS that tells you where your package is. That's how that data should work. We should be able to make a request for the data, for the health data, get the health data, not even move it into our system unless we need it for care. And then, process some things, and then allow that data to reside wherever. I've already talked about this too much. On to the next story. Healthcare Finance News reports close to 1/3 of healthcare employees have never received cybersecurity training, the report shows. And he goes in to talk about this report. And actually, all I really need to read is that headline to say to you, the number one thing you need to get out of this story is 100%. The attack vector that is the easiest to breach is your users. 100% of them need to be trained on cybersecurity, and it needs to be constant, ongoing training on how to use systems, and that just is the way it is. So let's go into some of the breaches for this past week. I thought one of the things that was interesting to me is I hit a story. Which story was that? So that's the they've never been trained. There's another story. Where is it? 32 million patient records have been breached in the first half of 2019. 32 million patient records have been breached. Okay. Then we have phishing attack breaches data for 183,000 patients at Presbyterian Health System. That's phishing. There was a another attack of another health system in Louisiana that was 120,000 records. And then you had 10,000 patient records at Mass General had been breached. And these are all within the last 30 days. And it's, again, this continues to be a little disconcerting that this many patient records are being breached. When we do this, when we allow this to happen, and everyone knows this, I'm not saying it, when we allow this to happen, it is a significant violation of our trust with the community and the people that we serve. This is one of those areas where we need to be vigilant. We need to double down. We need to be training people. We need to be putting the right tools in. We need to be looking at innovations that are happening around artificial intelligence across the wire, looking for these things, shutting them down quickly, addressing exfiltration based on patterns. You name it. We need to be doing this. We need to be getting the budget dollars. The so what on this is we need to be training people. We need to be getting the budget dollars we need to secure the data. Because if you can't secure the data, you shouldn't be. You should figure out some other way of housing the information you need to run your health system. I thought one of the more interesting stories, though, it's kind of sad that those stories have become sort of old hat. I'm sort of like, hey, 100,000 patients here, 120,000 patients here, but 32 million patients in the first half of the year. That's startling. But if you think, well, Silicon Valley knows what they're doing. They really have this thing down. I read this story. Apple just gave 1.4 billion users a reason to quit their iPads and iPhones, according to Forbes. That's not going to happen, but I'll read some of the story for you. Google's Project Zero security team broke the news, revealing that hackers quietly developed a system which enables disparate iOS vulnerabilities to be daisy-chained together to gain complete control of your iPhone and iPad. All owners had to do to be exposed was visit a certain website, and Google estimates that thousands of visitors per week did just that. Once in, hackers had full access to your photos, your contacts, your private messages, and even encrypted data such as passwords held in your iOS keychain. So, it goes on. But, I would. It's a Forbes article. I'd recommend you look it up. It's worth looking at. And for those of us who have physicians and clinicians who use iPhones, and there's a better than average chance they reuse the passwords they use in the hospital on their phone, and they save it in their keychain. There's a chance if they've been breached this way that their passwords have been breached. So again, and one of the hardest things to do is when people are coming in with the right credentials, is to identify, when the systems are being misused and they're exfiltrating the wrong data. So, this is just something I wanted people to be aware of and to be planning for. It's something that should be a part of the conversation that's going on. All right, that's enough about security. Bar is rising for consumerism in healthcare, but providers are still playing catch-up. Jeff Legacy, Healthcare Finance Weekly. So many industries these days cater to increasingly online, convenience-obsessed, and consumer-focused world, and while healthcare is no exception, it has a lot of catching up to do. The results of a Kaufman Hall's 2019 Healthcare Consumerism Index highlight the challenges that legacy healthcare providers face in trying to grasp firm handhold on the ever-rising bar of consumer needs and expectations. The index provides a lens into the industry performance related to consumerism based on survey responses from hospitals and health systems nationwide. So the index placed organizations in four main tiers. An organization in Tier 1 is defined as best in class through Tier 4. You get the picture. Hospitals and health systems continue to emphasize building facilities over creating convenience, the report found. While more than half the respondents offer urgent and ambulatory care centers, only a third offer widespread basic online scheduling for existing patients. So we're building out new urgent care centers and ambulatory care centers, but we're not investing enough money to do more than a third or less than a third are doing online scheduling for patients, which we know is one of the highest desired things within the digital platforms that we provide. Just 9% of the organizations rated as Tier 1 performers for access, down 3 percentage points from 2018. Those in Tier 2 rose 6 percentage points over the same period. Nearly 80% of the organizations report having no subscription-based primary care services. A third offer widespread online self-scheduling for existing patients, but few offer this service for new patients. Same-day appointments and extended and walk-in hours are common access strategies, and 38% of respondents offer widespread save-a-spot urgent care, while nearly 60% offer it on a limited basis. This is a great survey, by the way. It just maps out some of the things that patients are looking for from their digital tools and from their health systems in general that digital can really support and streamline in terms of really driving down the friction, increasing the access, and increasing the convenience factor of working with your health system. And for those of us who have been in healthcare for any period of time, all I will have to do this afternoon at our Labor Day party is bring up that I am in healthcare, and the people who are here who know that will tell me their latest healthcare story, and they'll say, let me think, my most recent one, first of all, calling to it's going to be one of my hot buttons this year is calling in to schedule. Okay, so first of all, having to call in to schedule. So they call in to schedule, they get to the place where they need to schedule, and they say, oh, no, you're in the wrong place. Let me transfer you. So they transfer them once, they get to another person, and they say, oh, no, they were wrong. You need to go back to the other thing. They said, well, can you transfer me back? And the answer is, no, we can't transfer you back. Our phone system does not have that capability. You're going to have to call back in. So they end up having to call back in. The fact that, first of all, we should have the ability to do online scheduling for something as simple as, it was a mammography, by the way, for something as simple as a mammogram, we should be able to have online scheduling. But the second thing is these phone systems. Through M&A and things that have happened, we've gotten to these phone systems that are so convoluted that we can't, for whatever reason, we can't transfer people effectively across those phone systems. So the consolidation of call centers, the ability to route calls, and my guess is that if your phone system is that antiquated, you probably don't have some of the advanced tools that are available on some of these. I'm not recommending this, but I'm just saying some of these cloud-based phone systems. I have talked to especially retail-based health practices that are using cloud-based phone systems and have phenomenal capabilities in terms of routing and reports and metrics and all sorts of other things. It's exceptional. So we should have some of those things, and a lot of us haven't been able to implement them just because the cost is so high. I can't believe that's 20 minutes already. Here's what I'm going to do. I'll hit because I probably won't cover these stories. IBM's Dr. Watson may have been misguided from the start. I think that's an interesting story, but pretty hard to go into that online here today. That is from AI in Healthcare, Innovation to Transform Healthcare, IBM Dr. Watson, Dave Pearson article from August 12th. I think that's an interesting article worth reading. It's really about what people have been saying for a while, which Watson bit off more than it could chew from the get-go, and really should have been a lot more focused a lot more narrowly. A much more narrow focus would have helped them significantly, rather than trying to market and advertise where they were trying to go or where they thought they could go. Let's see. 2/3 of consumers say they're interested in telehealth, but far fewer have actually used it or given it a try. This is from Moby Health News. Dave Muoio is his last name, August 28th. Again, interesting read, worth looking at. I think it speaks to the fact that there's still a cultural shift, and we need to educate the consumers on the value of telehealth and the value of using it, and get them to use it for the first time. Much like we did with MU with the portal the first time around, we're going to have to do the same thing with telehealth, it feels like to me. HITinfrastructure.com There's a story, CDSS could, or Clinical Decision Support Systems, could replace EHRs as clinical interface, says Frost and Sullivan. And that is from, again, hitinfrastructure.com. Fred Donovan doesn't have a date, but interesting read, worth looking at. Anything that gets that sort of can set itself in the middle between a user and the back-end system has a disruptive quality to it. So it's something to always keep an eye on. I already told you about Google's plan to reduce the lifespan of SSL certificates, and I think that's important to keep an eye on. I'm going to come back probably next week to this story. It's your right to see your medical records, and it shouldn't be hard to do this. It's an NPR story that I got online, worth taking a look at. That's all for this week. Every Friday, check out our interviews with industry influencers, our 2 from last week, the 2 Davids on the UGM conference if you want more detail on that. Keep the comments coming. Bill at thisweekinhealthit.com. Good, bad, or indifferent. It all helps. Really appreciate it. This show is a production of This Week in Health IT. For more great content, check out the website, thisweekhealth.com, or the YouTube channel, thisweekhealth.com. At the top, there's the... you can click on YouTube. You can click on our 2 resources, insights, and staff meeting, and any one of our archive show. Thanks for listening. That's all for now.